severe back pain that I'd never really experienced before. I'm an athlete, so I know all about pain, and this was totally different for me. It was shooting and very debilitating. So I talked to a couple people, I tried chiropractors, trying to get as much information as I could. And my husband, who was a PA, he recommended that I call Dr. Vlach because she was pretty much a guru when it comes to back injuries and neck injuries, and she's a great physiatrist.
Shelby came to see me with a pretty classic low back injury, which was a disc herniation with some sciatic pain going down her leg and into her foot. I initially tried to treat her with the traditional conservative spine care model, which consists of physical therapy, select use of medications, and high-dose cortisone epidural steroid injections. This model works for some patients, but not all. And after going this round with Shelby for a few months, we had really made little to no progress, and she was very frustrated by her continuing persistent pain. At that point, I offered her a fairly novel and innovative treatment called a Platelet lysate epidural steroid injection, which is the same type of injection, but is using the growth factors from their own body. So that actually means that we took some platelets from Shelby's blood in our processing lab, stripped the cell bodies off the platelets, and then injected those concentrated growth factors, again from her own body, directly around the nerves in her spine. There's actually very good data for using platelet lysate as an epidural steroid injection, and even some studies comparing using the patient's own growth factors to a typical high-dose cortisone injection and seeing equivalent or sometimes even better results with the platelet lysate injection. For me, this was a really exciting opportunity to offer this novel treatment to Shelby, quite simply because in the past, even a year ago, if a patient failed that traditional spine model of care, I wouldn't have had anything else to offer them. After the third high-dose steroid injection, at that point, I'm really out of tricks in my bag, and oftentimes then I used to have to refer a patient to a surgeon, and most of my patients do not want to see a spine surgeon. So in Shelby's case, it was very, very exciting to offer her something new and different, and she had a tremendous response, whereas the previous injections had not helped substantially. This injection using her growth factors actually was the turning point for her, dramatically reduced her pain, allowed her to move forward with her life and really regain her function in life and as an athlete.
The best part for me was immediately I started to feel the strength come back in my leg, and I was like, okay, this is a start, this is good. And I felt, and every time I came back, Dr. Vlach said, it'll just get better. And I just kept trusting the process and trusting her, and it did get better. To the point where I woke up one morning and normally had to roll out of bed, sit up, hop out of bed, see how give it a minute to see if the nerve was going to shoot all the way down my leg. If it was, give myself some time. And it was very short. And I was like, oh, that's new, yay. So the next day, same thing. Roll onto my side, sit up, hop out of bed, wait for the nerve pain. There wasn't any.
One of the things I enjoyed the most in terms of working with Shelby is that she was a very motivated patient. In my practice, the patients that come to see me know that I'm not much of a fix-it doctor, meaning I consider myself in a partnership with the patient in terms of their care, meaning that I will bring to the table all the best resources that I have in terms of my training, my injection skills, my diagnostic abilities, but in turn I ask the patient to participate very actively in their care, meaning I almost always specifically ask them to make substantial changes in their diet, to watch what they're eating, and to exercise regularly on a daily basis. So working with Shelby particularly, that was very exciting because as an athlete, she was already motivated, she was used to working hard, and she was used to working her body. But I have found through experience that the patients that get better are the ones that take a very active approach towards their care, do not come to me expecting me to fix them, but come to me expecting us to work together to get good outcomes.
When I got hurt, taking care of my family was difficult. That was very hard. She saved me. This procedure saved me. It brought me back to where I'm crawling out of the mud again, which is something I actually love doing, is crawling in the mud. I do that with Tough Mudders, and the fact that I can actually do that again is huge, because losing yourself for so long it's a horrible experience. But knowing now that I'm fighting my way back, and I can actually fight my way back because this procedure is so amazing. Going from Division I athlete to working to doing nothing for a year and a half was very trying. I will be always a big, huge proponent of doing the PRP. It was the best thing I've ever done for myself, and I will never look back. And I get to do everything again. Yay! So that's me. Good luck.